Dr. Bature, should I go ahead?
Yes, please. We're on. Thank you.
Good evening, everybody. Welcome to our Young Ophthalmologist webinar. We welcome Professor Adio and Dr. Mustafa Bature, our President YOF. Welcome Dr. Adeleye Nurat, Dr. Oboforibo, Dr. John Amuta Temang Pamshak, Dr. Fingesi. Welcome, everybody. And happy World Sight Day with the theme, Love Your Eyes, Kids. So World Sight Day is celebrated annually on the second Thursday of every October. And it's dedicated to raising awareness about eye health and the importance of preventing visual impairments. This year's theme is Love Your Eyes, Kids, and it focuses on promoting eye care for children, highlighting the importance of early detection and protection of their vision. We have on board today an eye expert, a professor of ophthalmology, a consultant pediatric ophthalmic surgeon in University of Port Harcourt Teaching Hospital. She's a past chairperson of Nigerian Pediatric Ophthalmology and Strabismus Society, NIPOS. She is the director of the Lens Eye Clinic Rehabilitation Center for the Blind and Severely Visually Impaired in Port Harcourt, Nigeria. And she's a member of the Scientific and Ethics Bureau of WSPOS and a member of the IPOSC and ROP Africa Committee. Her private office is the Lens Eye Clinic. I present to you my mentor, a pediatric ophthalmologist with a difference, in the person of Professor Adio. She's going to take us through the theme of this year's World Sight Day, which says, Love Your Eyes, Kids. Welcome, Prof.
Thank you very much. I've been over-introduced, I think. I'm happy to be here. I'm highly honored. The Young Ophthalmology Forum has been very vibrant, and I appreciate this opportunity to be able to contribute to the information that is available out there. That is in public domain. Thank you very much.
Thank you, ma'am.
So I should just go ahead and introduce the World Sight Day. Is that what you're saying?
Yeah.
Yes, ma. Sure. You can go ahead,
Okay.
ma.
All right, so that's fine. So this year, the theme is Children, Love Your Eyes. It's more or less speaking to children directly, but you know, without the parents, children really can't make a move. So we're speaking to both parents and their guardians. And it's all about prioritizing child eye health. I believe this webinar is properly situated to target these parents and their children. So I believe it will be shared with the target audience with time. So this year's focus is on inspiring these children and their parents to take care of their eyes. All too often, we have only focused on adults we don't commonly focus on children. In fact, I don't think I remember any world scientist specifically targeted at children. So this is, something to celebrate, something to be loud about, very loud about it. So we want them to take care of their eyes, play an active role in taking care of their eyes. And of course, the government and everyone that is supposed to make a decision on this to make sure that, eye health is accessible, it's affordable, it's available for all these children. We all know that we have children who are also out of school. And those who are out of school also need to be remembered at this time. Those who are in school have a better chance because they'll be hearing and understanding and listening to what their teachers have to say during their health education classes and all that. But for those who are out of school, this may not be happening. So this particular World Sight Day 2024 is, to be something that we should be very happy about, because now we're focusing on children, whether they're in school, they're out of school. And we know that about 450 million children worldwide have a condition that's required to be attended to, a visual condition, a sight condition. And this is something that we have to make sure that we are part of as pediatric ophthalmologists, as eye care practitioners, worldwide, nationwide, statewide, even in your city, in your hospital, right there. And we have different ways of getting involved. As we go on within this webinar, I believe that with this short introduction, we'll be able to know the different ways that we can get involved in this particular endeavor. Thank you.
Yeah. Thank you so much, Prof, for that beautiful introduction. I think this is a spotlight on children about World Sight Day for the first time, and we believe there are so many important things attached for the IAPB and WHO to consider children in this year's theme. So why is children's eye health so important?
Well, children, they're the future of the world. And we know that when anything affects their vision, it can last at least 70 plus life years if it happens from birth, quite longer. For instance, if an adult has a visual impairment, maybe at age of 60 or 65, he has probably 35 thereabouts years left to live. But if a child at the age of 3 has an eye condition, he has up to 70, 80 years plus left years to live. So the number of life years that a child has to live is what makes this focus very, very important. That will be lost. That's what makes this focus on children very important. Children are sort of helpless. Even if a child does not have limbs, they usually find a way of moving. They don't have vision, they will find a way, one way or the other, to try and keep moving. But we know that if a child has an impairment of vision, they are at risk of dying much earlier, because looking for where the food is might be a bit difficult. They might not be able to struggle for food, like in families that are very large. And we know that children, when they are having all these issues, they're not likely to complain. So it's very important for a focus like this to be on them, so that we are, as a group, as individuals, as professionals, we're able to pay attention to them and be able to make sure that those parents who may not be paying attention at the time that this maybe in the past, we are able to focus on them to be able to pay attention more. And this thing doesn't know whether you're educated or not. That's one thing I've discovered. Even parents who are educated sometimes are a little bit, they don't pay much attention to their children in this area, or they begin to do things without realizing that it's going to affect their children in a deleterious way. For instance, if a parent, just because they can afford it, does not pay attention to the screen time of their child in terms of the use of digital devices, which we will agree that is almost everywhere now. Even the middle class, those who are, those who are not quite up to the middle class can afford to buy some sort of device for their children, so they can, such a child would likely develop or induce myopia, which may not have happened at all, depending on the behavior or the exposure to all these devices. So somebody who is educated can also have children who develop problems with their vision. So this focus cuts across both illiterate parents, those educated parents, those who are even in the ivory towers, even doctors. Some of them don't observe screen time among their children. So it's very important for us to pay attention. That is the reason why children, we need to pay attention to them within this period. There's so many things I need to say.
Thank you very much, Prof. So concerning this World Sight Day, when we have this particular mandate of, telling children to love their eyes. So in clear terms, how will this, how are they meant to love their eyes? What are they meant to do to actually show love to their eyes?
Very important question. One of the things that we always try and advocate when talking about school eye health is because it also exposes children to also learning about their own eyes, what to do about it, and to be an advocate for their own eye health. So if a child is educated in the ways that they can improve or keep or maintain their vision, they can spread it to the community. And wherever they are, even at home, my teacher said this, my nurse said this, some eye doctors came to our school and said this, my doctor also said this. We have to be intentional about all these things. So when children have been taught all these things, they can be an advocate of eye health. They can also monitor other children, even their own parents at home, concerning their eye health. They can be responsible themselves also, depending on how they are handled about their use of these devices I mentioned earlier. So children can be a very strong advocate, and they can be taught purposefully to get this done. Even those who have lost their vision can be an advocate for eye health. Now, talking about the parents, especially maybe a parent whose child may have lost vision, or whose child has a significant visual impairment, or whose child has to be on treatment for life. For instance, if the child has this congenital glaucoma that requires lifelong follow, somebody who has congenital glaucoma, who has lifelong follow, they can be strong advocates, depending on how they are handled for eye health. So these are some of the ways that children can also advocate for their eye health, and that they can be encouraged to plug in positively into these children, this particular theme for this year. Most of the time we are restricted to Children's Day, but this is 1 year that we have celebrated twice, both Children's Day and this World Sight Day. So this is a very good opportunity. Let's just talk about it. Let's discuss about it, go on radio. This webinar like this is very important. Share with your colleagues in the university, share with your colleagues in church, at your place of work, and all that. You can even make flyers and give to these children, and they can read and also share with their friends.
Yeah, thank you so much, Ma, for such insights about child's eye health and its importance. What role does the larger community, like teachers, play, or they should play, in order to promote child's eye health?
Yes, this is a very important question. Like I mentioned, school eye health is one of the things that we should be advocating as eye care practitioners in your states, wherever you are. And sadly, we don't have too much of that going on, primarily because we need to kickstart it in our different states, and secondarily because some of the teachers, sometimes they say, what is in it for them? But they have a specific role to play, because after parents, teachers are the ones that spend the most time with the kids. So in school, where they are well situated to observe how children behave visually in a class. You know, they may be in a class where the students have to move closer to see the board, what is written on the board. They come back to their seat, or you see a child that is not writing, or is not able to do or carry out assignments easily, or is bumping into things, or the eyes are red, or the eyes are itchy, or some problem with their vision, or the eyes are jiggling around, or the eyes are not straight. You know, so many things that they can see, or swellings, discharges, you know, tearing, all sorts of things that they can observe as a teacher. And then they can report to the parents or report to the nurse in the hospital, in the sick bay, or wherever is in the environment, whatever they have arranged for their systems in that particular locality or in the school, so that the child will ultimately be taken care of. We see many referrals like this. The teacher said this, and so I brought my child to the hospital for checkup. And then more often than not, we will find that there is an issue at stake. Even the teachers themselves is part of what we're talking about. They themselves could also have also require some assistance. So these are some of the things that we also need to look at. When you look at the teachers, you look at the children also, then you make sure that everybody within that environment is able to carry on their duties and are able to learn in an environment that is where they can easily access information without any stress. Even positioning of a child, like for instance, an albino child may be positioned where there's a lot of reflection, maybe where the light bulb is placed, the class, or the position of the child. If it's to one side, the light will be reflecting off the whiteboard and will be causing reduced vision for that child. So the teacher has a role to play in responding to the instructions of the eye care provider. Usually we have to write letters for people like that to the school so that they position, whether they are tall, whether they are or not, does not matter. Because most times when somebody is tall and is visually impaired, they put them at the back, and then it makes matters worse. So the teachers have a role to play in making sure that even though the child is tall, is positioned in a way that can be able to access information without too much.
Thank you very much, Prof. From what you've said now, teachers are actually stakeholders in child eye health program. So they are really like an integral portion, and we need to carry them along because they are like people that are going and fishing to look for children that have visual impairments, and it's good for them to know the right personnel to alert. My next question is, how do we correlate academic performance with child eye health?
This is a very important question because many parents, they may not even look at the fact that of the possibility that this child may not be seen as well when their children is not doing very well in school. I always say to parents, before you start smacking or punishing that child, check and see, is the vision adequate? You know, so when a child is having problems with education in school, ensure that the vision is also checked. And you make sure that that child goes to the hospital and has the eye checked. There could be a number of problems that could be wrong. One of it is corrected refractive errors. As simple as this, still find some parents having problems with this. Sometimes I tell parents, are you going to be embarrassed by this? Or what is the issue? Why is it that you feel that this child should not wear glasses? It's too small to wear glasses. We're very responsible. I always tell them about giving glasses. There are guidelines in giving glasses. We follow this guide. Just give glasses for the fun of it. This child requires glasses. That is the reason why this child needs to wear glasses. So we counsel. So you have to be a very good counselor, to an eye care practitioner, when you're dealing with such scenarios. So once a child is discovered to have these problems, you try and solve it so that this child will not have issues with their vision. I don't know whether I've answered this question or there's some other area that you want me to talk about.
You have answered. Before you use the cane to whip the child, you need to go through an eye check to make sure that the child is actually seeing what is being taught. Dr. Baturi, you can ask your question, sir.
All right, thank you so much. I'm actually enjoying this what I did, maybe because for about children. But finally, my question is on eye protection and safeguarding eye health in children. What are your advices about
this is an area that we don't often stress, but it's very important because more and more children, probably need to go out there to play. And we know that supervised play is very important. And children are vulnerable, especially male children, in acquiring injuries at play. So when children are playing contact sports, in particular, they need to wear eye protection. And we know that it's not just any type of eye protection, it needs to be something that is very much strong, like polycarbonate or even stronger, so that these children will not have any accidental injury to their eyes. They're playing football, they're playing maybe some kind of judo or karate or martial arts thing. They need to be very much aware that something could happen to their vision, so they play in a protective way. So they need to be taught that they need to protect their eyes, they need to protect their face. They should not leave it open for attack one way or the other. You teach them self-defense, and so should wear eye protection when they are playing contact sports. When they are swimming also, they should wear eye protection. If they have had recent surgery, they must wear eye protection to protect them from dust and to protect them from excessive breeze and whatever that may be flying or accidental injury. Or they should be careful, even with playing with younger kids when they have just recently had surgery because of accidental injury. We've had cases where, and of course, we also heard of cases where the children in playing, the elbow, or accidentally used to hit eye that just had surgery. And then, definitely whatever benefit you already had from that surgery may suddenly be interrupted. Make sure that we don't have any injury of children. So it's important for us to look at all this. And I would like to stress another area in children, one of which, if I may, is behavioral modification. We've talked about it in passing, but behavioral modification is extremely important. Somebody was asking me also that, okay, what if it is not children? Are they just free to keep looking at devices and all that? So generally speaking, people should be very careful with the use of digital devices. A lot of people are now, especially adults, are more aware, so they use all these blue light blocking glasses because of the ultraviolet rays and all that. Everybody should be very careful in terms of avoiding eye strain and avoiding future ankylosing spondylitis and postural problems in the use of devices. Specifically for children, we know that it induces myopia. And myopia is one thing that we have discovered in the rehab center that I helped run, at least in 5% of cases, that they come in with very high myopia, which can lead to holes and cracks and a possible retinal detachment. And once this happens, because of the retina that has been stretched so thin, it's quite difficult to repair. Not that it's impossible to repair, apart from the cost, which we all know prevention is always better than cure. But once you're at that point, you have to just do something. So the best is for children and their parents to be aware that they need to avoid excessive screen time. It's all there online. You look at your device excessively, you're going to have challenges. If you're an adult, you need to observe the 20-20-20 rule. After 20 minutes of reading, you should look away 20 feet for at least 20 seconds. So these are all things that we need to imbibe. And of course, even for general health, you should move around after 1 hour at least of sitting down and reading. You know, so these are all things that we need to imbibe as you know, to make sure that our eyes last as long. By the time you just do anyhow, you might just see anyhow. You have to be very careful with your vision, especially in growing children. Those first few years are so important. Another area I would like to stress is the fact that children could also develop pupils in the eyes. You see a white reflex that shines or glows in the dark like a cat. Don't wait. Parents, don't wait. This usually happens around that when that child is 18 months, 1 year, it could even be younger. The younger the child, the more aggressive this problem is. So you should love your eyes to the point that you take these children to the practitioner, to the eye care practitioner to have their eyes properly checked. Once the eyes are checked early enough, these problems are picked up and vision and the globe is saved. In fact, if you don't pay attention to these areas, to this particular area, sometimes even the life of the child can be lost because there's a condition we call retinoblastoma that can actually affect the life of a child if it is not discovered. It can affect vision, if it affects seeing area, if it is neglected, the eyeball may have to be removed, sadly, and then also food, if it is spread and not attended to on time, affect even the life of the child. So these are things, especially in areas where these things happen. Sometimes it comes in, you know, in crops, you know, you need to see them one after the other. Sometimes you see, last week I saw one that was so advanced, we were almost crying. And these things are still happening. So we want to let everybody know, please, please don't wait. When you see something that you don't understand, don't, because the child is not crying, then you're now saying maybe it will go away. It may not. So please pay attention to all this. One other topical area is retinopathy of prematurity. We're seeing more of these cases. Before, it used to be in the textbook, we'll just see, oh, retinal ROP. It wasn't as common. But now we are seeing it more often. We're seeing it more often. Why is that so? Because we're seeing more women having access to assisted conception. And we are seeing more women who may not even afford all these that are now below the poverty line. Because we know that when children are growing, when there's poverty, we see more of babies born prematurely. When babies are too many in the womb, they come out prematurely, too small and too young. So this is a condition that is not even there at birth, and it should be screened for on purpose within 4 weeks. So anyone that is responsible for the care of these children, it could be midwives, it could be nurses, it could be gynae doctors at the point of delivery. They should let these women know that are exposed, that are already, maybe they're having their children before the date. Particularly, we have guidelines in this country. Anyone that is 1.5 kilograms, any baby that is delivered before 32 weeks, such a child should be examined within 4 weeks, 4 weeks of life, or before they are discharged from the hospital. You might be surprised that this child that survived, you know, has developed ROP. You don't do something about it, you have a live child that is not able to see. And this vision could go as quickly as within 2-3 months of life. And then it's completely irreversible. So these are all important areas that we need to stress as eye care practitioners for all those who are involved in the care of these children. Thank you.
Thank you. Thank you very much, Prof. In fact, a particular area that always scares me, it's trauma in children, especially caused by caregivers. It's a very traumatic area. you see a child that has been flogged by either the teacher or the father and has lost vision in that eye. So I don't know how we can actually get across to our target population to pass this message out that indeed we should love our children's eyes because it makes a whole lot of difference.
Yeah. Well, we've seen
Okay.
many cases. That's a very important area. I would just like to make a comment on that, where parents on the average won't come until at least 3 or 4 days or 3 weeks after until they see a white spot for the these are areas we need to keep talking, we won't keep quiet. That's just what we just need to do. Because the earlier you come, the more likely that that child that vision will be maintained because treatment will be instituted on time. And of course, even as eye care practitioners, when we come, we have to try and reduce bottlenecks because especially for those of us who are working in the ivory tower in the teaching hospital tertiary center, sometimes there are a lot of bottlenecks. Somebody comes from a very remote area, has spent so much money to get to that place. If you give an appointment, it will be a problem. If you keep them waiting for too long, they'll be watching. Maybe they don't have enough money for a hotel, or what they have is just enough to take care of that child. And then they dissipate it on different things. As much as possible, let's try and attend to these people time so that they can exactly know what is wrong without wasting too much, so that they get on with actual care of these conditions. As much as possible, we want to learn that they're out from outside the state. Let's try and expedite the care movement through the different levels of bureaucratic team that are there in our hospitals. Like in our hospital, we allow them to come in. It's almost like a primary healthcare center. They come in straight. So we don't really have much choice in that area, though, because the primary eye care is not yet fully in place. So once the primary eye care and secondary healthcare systems are fully in place, we might see more response in this area because they are closer to the grassroots. I believe the government needs to do what needful to make sure that this area is also attended to. Thank you for that question.
Thank you very much, Prof. Indeed, this World Sight Day, we're really enjoying it. The focus on children is very important. So thank you, participants. The floor is open. If you have any question, comments, area of clarification, you can lift your electronic hand up and ask, or you can put it in the chat box for me to read. I hope we are benefiting from this webinar. Thank you again, Young Ophthalmology Forum National President, Dr. Batsure, for making this happen.
Thank you so much, Dr. Diamond, our special guest, Professor Adio. We really appreciate your coming, and you have really given us so much insight about World Sight Day, and we're happy it is Love Your Eyes Kids. So we hope to have you another time, and we hope to see more of the World Sight Day celebrations. Thank you all for coming. We really appreciate it.
Yeah. Thank you very much for inviting me. I appreciate it.
Okay, so thank you very much, YOF Exco here present. Thank you very much, Dr. Batsure, for giving the South Young Ophthalmologists Forum Zone the opportunity to host this webinar. We're very grateful. We've actually benefited a lot, as seen in the comments in the chats, as seen in the comments in the chat box. And Professor Adio is always open and waiting to help in advocacy and placing the child where the child is meant to be. The child's vision is her priority. So whenever you want her, knock on her door and she would open with arms wide open. My name is Diamond Tonyo Obene. I've been the moderator.
I think there's a question on the chat box. Someone is asking.
Okay, so how do preterm children born outside the teaching hospital benefit from the retinopathy or prematurity screening?
Okay.
Okay, I can give our own experience. Yes.
Okay, she says.
Our own experience in the hospital here. Should I go ahead with that?
Go ahead, ma.
Okay, so in our hospital, we have done a lot of advocacy with hospitals within the community. Everyone that is involved with the care of delivery of women, we have invited their pediatricians, we invited the gynae team, both the nurses and the surgical staff, because even before the baby is born, this particular group of people, that's the gynae team, are involved. And they already knows the ones that are predisposed to having preterm labor. So we invite them, and then we have seminars from time to time on this. So anyone that is born outside the hospital where they don't have the the equipment to examine these children, because in University of Port Harcourt Teaching Hospital, we have the equipment right down to any kind of treatment you want for both diagnostic and therapeutic for these children. So in the other hospitals, they don't have this. So if they refer these children, we have a small fee. There was support sometime for the first 2 years, but that is over now. So we have a small fee to maintain the services so that anyone who comes in, very small amount, we examine them after they pay that sum, and then we re-examine. If they have any problems like that means they have ROP, that is treatable, type 1 ROP, then that same day or within 72 hours, we treat them with the services that we have available. And we have 2 people that are permanent staff of the hospital that help us to look for these patients. We've done flyers, we've done banners, and we're also open to radio and television interviews and webinars like this, so that even more advocacy is made. So they follow up these parents, with, in fact, to the point that they call them, the social services also, we encourage them to follow after them. And then when they come to the clinic, we make sure that we don't waste their time at all. So once they come in, you know, parents who have very small children or preterm babies, they don't want to be kept waiting. And then because we have an equipment that enables you to actually see the ROP live, what we call the icon retinal camera, then they a lot more women, in fact, they are eager to have their babies screened so that whatever is wrong that they cannot see physically, once the camera is placed in the baby's eye, they can actually see. Once the baby is cured also, they can also see. So they know the difference between when the baby had that problem and when they did not have. So anyone born both within and outside the hospital also has equal access to attending or to being seen ROP screening room. So anywhere where these facilities are available, and we in Port Harcourt happen to be the very first, University of Port Harcourt Teaching Hospital happen to be the very first within this country to have that service. I believe there's another hospital elsewhere that is also having that service now after we had it, but we're one of the first 3, the 5 pilots in the whole of Africa where this is being done. So we have all the, even from outside the state, we have people bringing in their babies to have their babies' eyes screened. So they are all welcome to come to the hospital and also benefit. And we have saved quite a number. So that's our experience.
Thank you very much, Ma, for bringing the Port Harcourt South experience. And you forgot to tell them that you're actually open to actually have people come over to be trained in ROP.
Oh, yes.
And
you
also have NIPOS training in our center too. And we also, so Prof, go ahead.
Yes, indeed. Indeed, we like I said, we have periodic training, which is open to anyone. And we have everything you need. We have the laser, both the LIO and the one that is slit lamp mounted, to actually learn how to give laser to these babies, adults. We also have the icon retinal camera. We have the device, the equipment, also the know-how. We have a special needle that's You cannot go wrong. You know, when you use the orange needle or any other longer needle, you can actually pierce to the other side because of those very small eyes. So we have a special needle, 1 millimeter away, you push it in all the way and you can, no fear, nothing is injured. And then you deliver your Avastin, baby's eyes. So we have that in place. So we are eminently situated and we have all the lectures that we have developed to be able to train anyone for this. You can come into the University of Port Harcourt. We have facilities for accommodation and all that is affordable. 1 month, 2 weeks, you can be with us, see what we're doing, have that training also. So that is very much available in our center. Then we also have the NIPOS Fellowship. We're one of the 7 or 8 centers in the country that is accredited. Once you're accredited for West African College, you can have a NIPOS and you have a pediatric ophthalmologist that has at least 5 years of training. You can have your center accredited to train a fellow. So we're also accredited for that. You can do your pediatric ophthalmology. And we're also accredited, though we are waiting for our letter, we've had a visit from West African College to train pediatric residents in pediatric ophthalmology. So you are welcome. We have all the, in fact, if you see a pediatric OR, you'll be marveled. We have quite enough, every sort of training that you want in pediatric ophthalmology. You are very welcome. I usually tell residents and medical students that if you didn't do pediatric ophthalmology, you have not done anything. We're the future. We're taking care of the future of the country.
Thank you, Prof. Indeed, this is World Sight Day, and we will actually love the eyes of our children, the eyes of our patients. So as healthcare professionals, we've been charged to go out there, spread this message to all nook and cranny that kids are the future. They are important. Let's place them where they ought to be. Let's love their eyes and prevent any blindness that can come out from maybe carelessness or anything. Thank you very much, Prof. A big thank you to our participants. I'm sure that we've benefited. We're grateful. Thank you very much, the Dr. Bature-led Young Ophthalmologist Forum and the EXCO. We're very grateful for giving South South the opportunity to host the webinar. My name is Diamond Tonyo Obini, and I'm the Young Ophthalmologist Forum South South Coordinator. And it's been a pleasure having this fantastic discussion with you all. Thank you, ma.
Good night, everyone. Happy World Sight Day.
Yes, good night.